Okay, this is a video for home wart removal. This is the wart that we're talking about. Hang on here, what? You can't really see it. There we go. So there it is, just there. You can see that sort of cauliflower texture to it, which is pretty characteristic of a wart. We have to try and get rid of that. And we're going to be using we're going to be using box cutter and nail scissors. Basically, warts pretty much just affect the skin. They don't go much deeper than that. So if you have the epidermis, the dermal layer, and below that you got the sort of subcutaneous fat and connective tissue, and you've got a wart in there, you really don't have to cut much more than just down, across and out to get rid of the mass of the wart itself. That's all we're going to be doing. The wart we're going to be cutting out has resisted cryotherapy, cauterization, and salicylic acid. So yeah, this is sort of a last recourse. It's very difficult getting doctors to do this, so I find I'm just better off doing it at home. I would prefer to have a scalpel. The first time I did this, I had a scalpel and that was much better, but it's hard to get them from just your average chemist. So you want the sharpest blade you can possibly get. That will minimize the pain. And we're going to be doing this outside because there can be a fair bit of blood, and it's good to have a garden hose on hand just to wash away that blood, so you can still see things. I'll probably need to clean this up a bit. I've just got some alcohol here, so we'll just dip that in there. Nail scissors for making the lateral incision. So yeah, just give that a bit of a clean. Okay, that'll do. Alright, so we'll go outside and we'll cut this out. The first time I did this, I was living in an apartment and there were people all around, and I got a bit conscious and I hurried the job. So I'll include that in this video as an example of what not to do, but we're going to do it properly this time. So we'll just head outside right now and get this job done. Alright, we're outside, we've got the hose going. I'm going to need both hands for most of this, so I'll just position this iPad on a little ledge here, and we're probably going to have to edit it afterwards because it might take a while. I'm not trying to win points for my surgical technique here. Obviously I'm not a surgeon, so yeah, it's just going to be you're basically getting the job done with a minimum of fuss. Okay, we'll start cutting. As straight up and down as possible. I'm getting a bit of blood, so we'll just start to use the garden hose now. Just show you sort of more up close what that's like. There we are. So nothing very technical there, just a straight circle around, as vertical up and down as possible in terms of the incision. And I'll probably just stop the video now and come back to it when we're ready to make the lateral incision with the nail scissors. So it's really just busy work from here on in. And once we're down deep enough, we'll make that final cut, and I'll show that on the video. All right. Made an incision all the way around that wart, down to a level of about 2 mil or so. So we'll get these scissors and we'll cut across the base, cut out, hopefully underneath the wart, get out as much of it as we can. And this will bleed a bit, but just try and wash it away, keep it as clear as blood as possible with the hose, which is still running there. There it is. And yeah, so I'll just tape this part, and that should be a done job. That's just the... oh dear, where are we? That's the main sort of mass of the wart there. I am going to have to... yeah, I am going to have to do some mopping up because there's still bits of it left in there. So we'll just keep going and see if we can get this as close to done as possible. So I'll just mop this up. I'll probably turn the tape off for a bit and come back to you a bit later. Okay, so this is just an after video basically. It's actually probably the best part of 6 months later. So what I did is I cut that wart out. I also applied just commercial over-the-counter salicylic acid solution, which is just, you know, your normal 40% salicylic acid, for about 3 days to the spot where I put the incision. So it was about there. So just 3 days of just sticking a bit of salicylic acid in the hole. Then I just sort of left it bandaged up, just changed the dressing a bit, and within a week it had essentially healed, and the wart obviously hasn't come back. That's perfectly, perfectly smooth. So probably would have been a bit easier if I was cutting just normal skin, but the problem was because of all the cryo and all the other things that had been done, there was quite a bit of scar tissue, so it was a little bit trickier to cut. Okay, well I hope that's of some help to someone, yeah, I thought that was a reasonable result for just 5 minutes work and 3 days of applying the acid solution. Thanks.